So hi everyone, my name is Rosie Conic. I'm a current pain fellow at the Mayo Clinic in Florida, and I'm here with Dr. Max Fitzgerald. Dr. Fitzgerald, could you please introduce yourself as well?
Yeah, sure. Hi, everybody. Max Fitzgerald. I am a general physiatrist out of Rush University Medical Center in Chicago. I have been in practice for 10 years and enjoying all of that time, seeing a wide variety of patients' conditions, as well as taking on several different leadership roles within the institution and AAPM&R.
Great. So we'll start with our first question, which is why did you choose PM&R?
Good question, and one I ask myself every day because it's truly a joy to do what I do. And I think, um, in a quick aside, I went to medical school thinking I was going to be a pediatrician. And for a variety of reasons, I just ultimately decided that that wasn't the right path for me. But my entire medical school um, career, I'd also had participated in physical medicine rehabilitation activities, interest groups, and it was just a passion from the standpoint of really looking at a person through the lens of function and thinking about how disease process impacts day to day as opposed to how disease process in affects cells or molecules or whatever. And I thought for me that was just a really important alignment with my approach to medicine and patient care was goal-oriented treatment that had impact on the person's day-to-day life. And I love the neurological system. I love the musculoskeletal system. I love the psychiatric conditions. So these kind of play a role together in terms of, what we see and treat. And it really was what interested me. And while diagnosis matters and that part of the assessment is really important, the treatment plan and figuring out how to make someone's day just a little bit better is really what.
What drives you? Yeah, I agree with that. I feel the same way. Um, so you mentioned some leadership positions at Rush, but what drove you to apply to the Future Leaders program?
I think one of the main elements of the Future Leaders program that was appealing to me was that sort of intersection with advocacy for our specialty within the academy, but also external to the academy, and getting authors at a similar career level from all over the country to be able to see what they're doing locally, what they're doing within their institutions or their networks, and how do we learn from each other, support each other, and figure out some of those skill sets that can grow and develop to really, bring our specialty forward and figure out some of the ways that we can just advance sort of our interests for patient care for our provider and our specialty needs. And it's a tough landscape in healthcare, and so this program I thought was a great way to get physiatry specific skills or perspectives that kind of tie into what we want to be able to do.
Yeah, that's so important. What do you feel has been the best part of the Future Leaders program, and do you feel that this has affected your practice or approach to leadership that you take currently?
It's probably what a lot of the other future leaders are saying, so I hate to be redundant, but it's the people, really. I think that piece of it is just it's really fun and invigorating is meeting colleagues from other institutions and places in the country that I wouldn't necessarily have crossed paths with. It's either clinically not aligned or whatever. And so getting to see how, Stephanie's doing things in West Virginia or sorry, Stephanie's doing things in Colorado or
Mhm.
West Virginia. We have two Stephanies. So it's important to keep in mind. But I think that for me, one of the pieces that's just really, really exciting is learning perspectives and challenges at different places with different populations, different um, pressures, but then also what we have in common and having that shared place of like, okay, yeah, I can see how that impacts you, and learning from people that are doing things that impact my day to day. And the obviously there's really great programming involved in the future leaders curriculum and sort of skill development, leadership development, media training, advocacy. Like those are a lot of good focused attention on how to do those things and cultivate those skills. So I definitely appreciate it, but I think the greatest value for me is sort of getting that nice, strong network of people that you can lean on and gain experience from. And in terms of like how that impacts my day to day, what you know, and like I've seen how I do things locally and in my institution, and that's great. But taking someone else's approach to a difficult conversation, or how do you operationally incorporate this element, that's been really, really helpful. I think that piece of it has been instrumental for me of like approaching things from a different lens or perspective that I hadn't previously done. And so just that constant exposure to each other and ways of doing things has been awesome.
Good. So we're currently recruiting for the next class of the future leaders. So why should members who are 3 to 10 years in practice consider applying?
You should apply to the program because you have a passion for physiatry. You have a passion to make our specialty even stronger, and to see how we can work together across geographies, practices, skill sets, industries to really bring physical medicine and rehabilitation to the place it deserves at the national table. And that's both for policy, but it's also for our patients. And I think this our academy is a really strong academy, but by size we have to kind of outpunch our population, because we take care of a lot of really complicated patients, but relative to the size of other medical organizations, we need to have strong people that can represent our views, and our academy has done that. And I think AAPM&R has really positioned itself well to advance the needs of our patients and our practitioners forward. And the impact is bigger than it outperforms the size, which is great. But the Future Leaders Program is just another avenue to find that next group of people to take a new perspective or a new challenge on, and continue to really promote physical medicine and rehabilitation as a key component of healthcare.
Yeah. On that note, are you working with any subcommittees within AAPM&R currently?
So I previously sat on the state advocacy committee. I served my terms and rotated off. So right now I'm kind of in between committees, although I'm looking potentially to join one and have some discussions coming up. But right now I don't have any other committee work, other formal committee work other than the Future Leaders Program.
Good. And now for a fun question. So what restaurant would you recommend going to in Chicago?
Oh, I mean, for what? That is such a great question. I mean, that's,
What's your favorite restaurant then?
okay. Well, I think, if you want a very sort of elevated experience, fun experience, I think Bavette's Steakhouse is one of the great Chicago, places to eat. It's
Okay.
amazing food. You're not going to walk out with a light bill, unfortunately. I'll tell you that. But it is just it's a really high quality institution with an amazing vibe, and I love that. That's tough to get a reservation, but worth it. I think that's. I was going to say it's just one of those things. There's so many fun places all the time. Like Monteverde's an Italian restaurant in the West Loop that has great handmade or homemade pastas. So it's like really depends what you're going for. But yeah, I think you can't go wrong. I'll tell you that.
Yeah, I was looking for some new ideas for. Well, I'm headed up to Chicago this weekend, so.
Oh, nice. Where are you staying?
I mean, we're staying. It's at the Rosemont, Illinois area, so we're just doing.
Oh,
It's a committee meeting. But when we come, I come for the AMA meeting as well, so maybe I'll see you there.
yeah.
Maybe.
Yeah.
But coming there in June. And there's a Serbian restaurant that just opened a branch there called Ambar. So I plan to go there because I'm Serbian and Chicago is where I get to eat my Serbian food.
Yeah. We actually, I mean, that it's funny because Chicago, obviously is known for like pizza and steak, whatever. I mean, that's all good. But we've got great like Eastern European Baltic food. I mean, like there's more Croatian restaurants than you would think in like Chicago, Polish. I wouldn't say cuisine. I might not make it in the interview, but we've got the second largest Polish population out. So it's like we've got a lot of really great you know, ethnic foods that are you don't get to explore as much as you would want to. And Chicago's got a great landing spot. So Serbians, obviously one of those, but yeah, huge. It's a great eating town, as evidenced by this. It's a great eating town. So it maintains this physique. But yeah, you
They'll
can't go wrong.
they'll probably cut that part.
Leave it in. I mean, I don't care. That part is fine by me. Whatever you guys want to use is use. I mean, I stand by it. But it's you can't go wrong eating it.
Yeah, maybe they get some new ideas. But that's it as far as my questions go. Those are
Great.
kind of. So, do you come to the AMA meeting? I don't think I've seen you
I
at
Or I haven't
those.
been the last couple of years. I used
Okay.
to when I was on the state advocacy committee, I would go sort of as a delegate. What's the basically you're there to observe, not vote. So I don't go through. I
Uh,
wasn't going through AAPM&R. I was actually going through like the
Chicago,
ISMS.
Illinois. Yeah,
Yeah.
yeah, Illinois Medical. Yeah. I was the AMA liaison for Fit Council for 2 years. Now I'm with Azra, but yeah, trying to plan my path through as far as staying involved in advocacy. Just
It's
always,
but it's I think super rewarding. That's my passion is advocacy. That's really I mean I'm so pumped for our day on the Hill in April. I think that's going to be really great culmination of this program and really kind of getting a chance to meet with legislators and connect sort of what policy is out there with what it means for people and
yeah,
how the work that we're doing really does impact care delivery and human beings and connecting those bridges for lawmakers I think is important. So really excited for that opportunity. And I think for you, if advocacy is a passion, whether it's future leaders or not, like AAPMR has avenues to maintain connection to advocacy work. So that's good. It's awesome for that you're doing it already.
yeah. Hopefully, it's always. I guess like that first year out in practice, it gets a little difficult, but we'll see. Planning on
You know,
staying involved.
I was going to say the one thing I do like to remind people is that you don't have to have signed a bill to be involved, right? So
Right,
like as you're getting into the feel of the real world and tending life and all that, like you don't have to have your involvement can be as little as writing a letter, right? Like
right.
that advocacy doesn't mean you have to go visit the state senator. So I think that's just, you do advocacy every day by taking care of people and, trying to do work for them and best practice for them. And, so that all adds up. But I know it's easy to say, but in reality, it's also important to remember. So thanks
Yeah,
again
that.
for the opportunity. And yeah, have a great,
Thank you again
great
for your
weekend.
flexibility and enjoy the weekend as well.
Thanks so much.
Bye.
Bye.